Opening. Welcome to Baby Care Tips UK, your go-to channel for practical, supportive, and NHS-friendly advice for new and expecting parents in the UK. Today, we're talking about the top 5 breastfeeding positions every mum should know. Whether you're a first-time mum or just looking for better comfort, these positions can make feeding easier for both you and your baby. 1. To cradle hold. First up, the cradle hold. This is the classic position most mums try first. Sit upright in a comfortable chair with armrests. Place your baby across your lap, with their head resting in the crook of your arm, tummy to tummy with you. Use a breastfeeding pillow if needed to support your arms and baby's body. It's ideal for full-term babies with good head control. 2. Cross-Cradle Hold. Next is the Cross-Cradle Hold, great for newborns or those needing help latching. It's similar to the cradle hold, but you support your baby with the arm opposite the breast you're using. So, if feeding from the left breast, use your right arm to support baby's head and your left hand to guide the breast. This gives you more control over positioning and latch. 3. Rugby or football hold. Third is the rugby hold, also called the football hold. This is perfect for mums who've had a C-section, twins, or large breasts. Hold your baby at your side, tucked under your arm like a rugby ball, with their body supported by your forearm and hand. Use a pillow for support and to bring baby up to breast level. This keeps pressure off your tummy and allows easy visibility of the latch. 4. Side lying position. Fourth, the side lying position. Best for night feeds or post-C-section recovery. Lie on your side with your baby facing you tummy to tummy. Support your baby's back with your arm or a rolled towel. This position lets you rest while feeding. Just ensure baby's nose and mouth are clear for safe breathing. 5. Laid back or biological nurturing. And finally, the laid back position, also known as biological nurturing. Recline slightly in a comfy chair or bed. Place baby tummy down on your chest and let them find the breast naturally. This instinctive position encourages better latch and bonding. It's especially helpful in the early days and can reduce nipple soreness. Conclusion. Every mom and baby is different, so try a few and see what works best for you. Good positioning leads to better latching, reduced pain, and a more relaxed experience. If you ever feel unsure, speak with your midwife, health visitor, or a certified lactation consultant. Don't forget to like, share, and subscribe for more baby care tips, straight from the heart of the UK. Try to generate clear and bold visuals of breastfeeding.